Okay, good morning, friends. Today we're going to talk about abdominal pain. Sometimes people confuse abdominal pain with stomach pain. They come to you, they say, "Doctor, I have stomach pain." But the truth is that you can really not elicit stomach pain because you cannot really touch the stomach, okay? So most times the right thing to say, you have an abdominal pain. That is now the duty of the doctor to localize what kind of pain you're having, okay? Now, you can either have pain on the right side of the abdomen or on the left side of the abdomen, okay? Some will come to you and say, "Doctor, I'm having ulcer pain." And you then ask them, "Where are you having this pain?" And the person points on the upper right side of the abdomen. And you would laugh because ulcer pain does not come on the right side of the abdomen, okay? Now, when you're having pain on the upper right side of the abdomen, in the mind of the doctor, we're talking about the liver, the gallbladder, okay, and the other structures around that area. But if you're having pain on the left upper part of the abdomen and sometimes on the upper center of the abdomen, yes, we'll be thinking of gastritis, gastroesophageal reflux disease, then gastric ulcer. But the truth is that most times people tell you that they have been treating ulcer. And you now ask, "Have you done endoscopy?" This person said, "Doctor, waiting be endoscopy." You see? Now, you can only diagnose peptic ulcer disease by the means of an endoscopy. Okay, what is an endoscopy? Okay, an endoscopy is a fiber optic camera in a flexible tube, okay? You use it from your mouth, go through your esophagus, your stomach, then your duodenum. Then we'll check if really you have ulcers, okay? And I can tell you comfortably that 95% of people have never had an ulcer in their lives. Most times what they have is gastritis, okay? Just few injuries in their stomach. It is rare for you to have people who have real gastric ulcers or even duodenal ulcers. But when you see them, they are very, very serious, okay? So, in this part of this video, we're going to concentrate our effort to explaining how you diagnose ulcers, whether gastric or duodenal, and how and who should manage it, okay? First and foremost, you see, people do some blood tests, they call it H. pylori, okay? Say, "Doctor, I did H. pylori and it's positive, therefore I have gastric ulcer." No, you don't have gastric ulcer by mere having H. pylori, okay? What is H. pylori? H. pylori is a bacteria, okay, that you find in the stomach, okay? Is one of the bacteria, or the only bacteria that survives the harsh acidic environment of the stomach, okay? So these bacteria has devised a mechanism of neutralizing the acid. Then it attaches on the walls of the stomach and continue to damage it, okay? Now, but this damage is not of the same degree, okay? So, H. pylori alone is not enough to diagnose peptic ulcer disease. Okay, when I mean peptic ulcer disease, that is both gastric and duodenal ulcers. Okay, then the only means by which you can diagnose peptic ulcer disease is through an endoscopy. Okay, now when this is diagnosed, say, okay, this person has peptic ulcer disease. Now, it must be managed, okay, it should be managed by a gastroenterologist, okay? Other doctors can manage it also, but because you would need follow-up, you would need a gastroenterologist if you have gastroenterologists around to manage it. But if you don't have gastroenterology around, every other doctor could manage it using the specified protocol, okay? So the second thing that could occur in that part of the abdomen is gastroesophageal reflux disease. I know most persons do not know about this. Some will tell you, I have ulcer. Lo and behold, they don't have ulcer. They have gastroesophageal reflux disease. To me personally, as an endoscopist and as a doctor, I fear gastroesophageal reflux disease more than I fear peptic ulcer disease. Because the truth is that gastroesophageal reflux disease